Hi, so my name's Erica Nymberg, and my TED Talk is on comparing healthcare between Spain and the United States. So just overall, a type of healthcare system, Spain has a universal healthcare coverage, which means if you live in Spain, you qualify for their public health insurance. However, many choose to supplement with private healthcare, and a reason someone might choose to supplement is that you have faster treatment procedures, faster results on diagnostic tests, and it's also easier to get a consult with a specialist if you supplement. So let's say someone wants to meet with a cardiologist, they're going to have a significantly quicker, less of a wait time, so they're going to get in to see the specialist a lot quicker than if you would choose to not supplement. And around 90% of the population utilizes the public insurance. In comparison, the United States has a mix of both public and private health insurance. So the public is your usual Medicare, Medicaid, and CHIP. And private is usually employer-based, so your employer would provide your health coverage. In terms of life expectancy, so Spain has a significantly higher life expectancy than the United States. They're actually ranked third overall, and a recent study in The Lancet predicts that by the year 2040, Spain will be number one in terms of life expectancy, which is pretty interesting to note. In comparison, the United States is ranked 34th, which is actually pretty low in comparison to other developed countries, so that's something to look at. Overall, Spain has about a 4.5-year greater or increased life expectancy compared to the United States. Healthcare spending, so total spending per capita, the United States spends about triple what Spain spends per capita in terms of healthcare. So here you can see Spain spends about $3,300 per capita, whereas the United States spends about $10,200. And a lot of that can just be traced back to their type of healthcare, so they're universal versus both public and private. In terms of preventable deaths, so just to define what a preventable death is, it's basically, sorry about that. It's basically the number of years of potential life loss before age 75. So Spain has about 160 people per 100,000 compared to the United States, which is almost about 7,500 per 100,000 in 2018. And just a little bit of a breakdown of common causes of premature death. So heart disease, which shouldn't come as that much of a surprise since it's one of the leading causes of death in the United States, but it's about double what it is in the United States compared to Spain. Then we have lung cancer. We'll see in the next slide that smoking prevalence is a lot higher in Spain, so that's probably one of the reasons why these numbers are pretty similar. And then we have road injuries, which is about triple what it is in the United States compared to Spain. And then finally, self-harm, which is again almost triple in the United States. And one of the things I found while researching this topic is that under universal coverage, it's a lot easier to get access to mental health treatment compared to the United States. So that could be one of the factors that would kind of indicate why there is such a significant gap between these two countries. And then one other thing to note is that premature deaths due to drug use disorders is one of the leading causes of premature deaths in the United States. However, it's not even within the top 10 in Spain. So just kind of gathering why the opioid epidemic is such a big current issue in our country right now is probably contributing to this super high number, 7,500 premature deaths, and how that could influence our value. In terms of public health, so tobacco control efforts, like I mentioned, Spain has a much higher prevalence of smokers. Approximately 30% of adults use tobacco daily in 2015, compared to just about half in the United States, about 15.5%. Spain also has higher cigarette imports, so about 25 million compared to 11.5 million. A lot of this is due to culture, so Spain has a much, the Spanish culture is much more inclusive of smoking and just like family gatherings, and just it's a lot bigger part of their culture compared to the United States. In terms of tobacco control efforts, so Spain joined the WHO Framework Convention for Tobacco Control in 2005 and subsequently passed two laws, one in 2006, which banned smoking in the workplace, and following that, one in 2011 that banned smoking in both bars and restaurants. So to speak from personal experience, I studied abroad in Spain over the summer and can say that these two laws aren't that well enforced. So there's a lot of smoking in bars and restaurants, and my host mom also said that there's a lot of smoking at her work. Although the policies are there, they're not enforced as well as they could be. So that's something to consider for future improvement for Spain. In comparison, the United States has had a lot of more regulations on smoking since the Surgeon General's report in 1964 that kind of recognized the dangers of smoking. And then a more recent effort to control tobacco was in 2012 when the CDC launched their first paid national tobacco campaign, which is called Tips from Former Smokers, and that was shown to be pretty fairly effective. In terms of physical environment, so we have air quality. So the average, so PM stands for particulate matter, and that's basically just the fine particles in the air per cubic meter. So the basic gist is that you want these numbers to be pretty low because particulate matter can contribute negatively to cardiovascular health and can contribute to heart attacks and strokes. So in general, 10.7 versus 8.4, it's not that significant of a difference, so they are pretty comparable. There's a big difference in premature deaths. However, it's kind of hard to, there's a lot of confounding variables that go into discerning a premature death due to air quality. So want to look at that just a little bit cautiously and not draw too many conclusions based on those numbers. Again, kind of going back to tobacco, the difference here is in enforcement. So the United States has a stronger enforcement of their air quality. They have had significant and consistent improvement in enforcing their air quality since the 1990 Clean Air Act passed. However, in comparison, more than half of Spain doesn't meet the European Union regulations for air quality. As far as access to care goes, so rate of uninsured, and this is also going to go back to the type of healthcare coverage. So Spain with the universal coverage has less than 100 people per 100,000 that are without coverage. So approximately 99.9% of the resident population does have coverage, which is awesome. In comparison, the United States, approximately 8,800 per 100,000 people do not have coverage. And to translate this back to the population in general, about 28.5 million people are without coverage. These numbers have improved since the Affordable Care Act passed, but it'll be interesting to see how the current administration and our current healthcare changes will shape these future numbers. As far as unemployment rates go, so Spain has a significantly and surprisingly high rate of unemployment. This number is actually down about 6% since 2016, so it's made some pretty good improvement in the last 3 years. However, there's still a lot of work to be done. There's a lot of different factors for why this number is so high, but some of the reasons that I found during my research was that Spain is still recuperating from the 2008 financial crisis that hit them pretty hard, as well as they've had some slow economic growth also kind of due to the financial crisis. In comparison, the United States is at about 3.8%, and in the past few years we've hovered around 3.84%. So it's stayed pretty consistent, which is good to see. But yeah, overall there's a big gap and a surprising difference between Spain and the United States in terms of unemployment rates. Okay, so overall this just has been like a general overview of healthcare and health policy between Spain and the United States. So you can see here on the left-hand side these 4 bullets. So we have a greater life expectancy, less healthcare spending, fewer preventable deaths, and just overall low number of uninsured. And so these 4 bullet points can most directly be traced back to the type of healthcare coverage, so the universal coverage. However, on the other hand, they do have higher smoking prevalence and a higher rate of unemployment. And a big factor of this is like policy enforcement. So the policies are there. It's just that they, in Spain, they haven't, at least due to my research, haven't been enforced as strong as they could. So in order to address these 2 areas of concern, there would be a greater need to either change policies or enforce the current policies that are in place. But yeah, thank you so much for listening to my presentation, and I hope you enjoyed it. Here are my references. Thank you.